Hi everyone, and thanks for the opportunity to present on this exciting work that was initiated by my colleague Kim Pearce at Cancer Council and culminated in a 2-day training program earlier this year, yarning about cancer. So just a bit of background. Evidence shows that there is a substantial disparity in the burden of cancer for Aboriginal and Torres Strait Islander communities, with Aboriginal people more likely to be diagnosed than non-Aboriginal people with advanced cancer. Health inequalities can be reduced by gaining a better understanding of the social and cultural determinants of health. Effective health service delivery needs to be culturally sensitive, with Aboriginal health outcomes positioned as a shared health sector community. In July 2016, the Cancer Support Group Leader Program, coordinated by Kim and myself, received a Cancer Australia Ralph Lauren Pink Pony Seeding Grant. We chose to use the grant to improve access to support and information for Aboriginal and Torres Strait Islander women through establishing a culturally appropriate training program to enable women to lead breast cancer support groups in their local communities across New South Wales. And so yarning about cancer happened. This slide reflects our Aboriginal facilitator Munya's opening of the workshop, granting the group in country. All of us were invited to pick a stone and to take it home. Some women who attended the training chose not to do this as they did not believe in removing items representing country. So from the start, we were aware that we were working with a very diverse group. There was quite a process that Kim and I decided to undertake before we put our offered our training up. We started by scoping current Aboriginal leader training manuals that exist in Cancer Council Victoria and through Cancer Council South Australia, and both of these manuals had been developed from previous Cancer Australia grants. We really focused on informing ourselves, consulting with Cancer Council's Aboriginal Working Group and the project manager of the Aboriginal programs at Cancer Council, Kristen Toohey, and she was an invaluable source of help to us. We attended cultural awareness training both internally at Cancer Council and through an external organisation, Alzheimer's New South Wales, at the end of last year. We then went on to develop a culturally appropriate 2-day training for Aboriginal and Torres Strait Islander health workers, healthcare staff and for women affected by breast cancer. This workshop was to be underpinned by the existing support group leader training that Kim and I have been delivering since 2013. We also made the decision that in order to really be culturally appropriate in working with the women that we did, that we needed to also have an Aboriginal facilitator, and so there were 3 of us facilitating the 2 days. We had to really plan the venue and the accommodation, realising pretty early on that the conference rooms at Cancer Council New South Wales, which have no windows, would be completely wrong for this group of people. And we wanted culturally comfortable accommodation. So we chose the National Centre for Indigenous Excellence in Redfern, which is a great centre. It also has a training kitchen, so we were assured of having really delicious food, which we did. And recruiting, which we expected to be quite a challenge, but ended up not being so difficult. We mainly recruited through Cancer Council's regional offices around the state, but we also had the opportunity to go to BCI at Westmead to their breast cancer education workshop in November last year, and that workshop was run for Aboriginal healthcare workers and nurses, and that was also as a result of the Pink Pony grant. And through that workshop we got some really good networks. So this is a map of New South Wales country, and it identifies where the participants came from. We had 18 women register, but 16 attended and completed the 2 days. So of the 16, 14 of the women were Aboriginal and 2 were non-Indigenous women. 2 came from the Mid-North Coast, 1 from the Northern Rivers, 3 from the Illawarra and Shoalhaven area, 3 from New England, 1 from Blue Mountains, 4 from the Central Coast and 2 from Western New South Wales. The circle around the Eora Nation reflects where the facilitators came from. We knew that 2 of the women participating had had their own personal experience of cancer. We had 2 women who were Aboriginal elders, and one of those was also a traditional healer. As I said, there were 3 facilitators, and we were also joined by 2 of our colleagues from the evaluation team at Cancer Council. As I've mentioned, the training was based on Cancer Council's evidence-based 1-day training, but we wanted to provide the training over 2 days. Kim and I realised that we needed to be more flexible in delivery and time management. The workshop needed to be interspersed with artwork. We needed to set up the room in quite a different way than we normally do, very informally, so that women could sit around in a circle. We kept the stones in the middle of the room for most of the 2 days, and people were able to sit on the floor if they wished to. And we worked aspects of the training modules that are up on the screen into stories shared by the participants and guest speakers. So these were the modules that we really wanted to deliver over the 2 days, but through activities, through general discussion and through guest speakers, we were able to really drill down into all of these modules. And the training and delivery was planned in consultation with Munya Andrews from Evolve Communities. Munya is an Aboriginal trainer and elder, and we were really lucky that Munya also became our third facilitator. So the focus of the workshop was about supporting women with breast cancer. We were very fortunate to have Alison, the breast care nurse from St George Hospital, come and speak on understanding breast cancer. We had two of the participants, health workers from the Illawarra Aboriginal Medical Service, Carla and Trish, and they currently run a Yarning Circle Cancer Support Group. So they were invaluable in sharing what they had learnt in the time that they've been running the group, as well as being really great participants in the 2 days. We were also really fortunate to have an Aboriginal woman, Wendy Brown, who we invited to come up on the second day and talk about her own experience being diagnosed with breast cancer. Wendy really utilised art, which helped support her and her family through her experience of diagnosis and treatment. And she also participated in the Wreck Bay Women's Yarning Circle, which is a general support group for women on the South Coast. This was a powerful and emotional experience for all of us and highlighted the use of the talking stick. You can see in the top corner Wendy is holding that. And that we decided was a great tool to have in a support group setting when we may have people who wanted to dominate group discussion. Through Wendy's story and that of her 3 daughters who accompanied her, one of whom had great facilitation skills background, we were able to incorporate other aspects relevant to leading a support group. For example, the importance of setting a group agreement to make sure that the group meeting is always a safe place for the participants, and how to manage the challenging situations which inevitably come up. There's some pictures here of Wendy's art. She brought this surfboard with her, which she has actually donated to the Illawarra Regional Cancer Centre, and it was very, very special. The workshop evaluation consisted of both qualitative and quantitative methods to try and capture the diversity of issues and means of addressing them. Quantitative methods included collecting data before and after the workshop through a registration form and a feedback form to strengthen the retrospective pre-post method of evaluating learning and self-reported changes in knowledge and skills. With appropriate permissions, the use of qualitative evaluation methods enabled the evaluators who attended the 2 days to both observe and participate in the workshop in a social context. Questions were asked in an open-ended manner to the group, and participants were encouraged to share whatever they felt comfortable in sharing. The results of the quantitative pre-post training evaluation are up here on the screen. The blue line is the pre-questionnaire, and the reddy brownie line is the post-evaluation questionnaire. And this indicated statistically significant gains in each of the assessed outcomes. Participants reported feeling more confident to start a support group in their community. They gained skills in setting up a support group agreement and purpose, and gained more information about the role of Cancer Council and our support of Aboriginal people in the community. But for me, the qualitative data is what really gives us a rich picture of these 2 days. All of the women noted they had increased their knowledge and awareness of the practicalities of setting up a Yarning Circle support group, and understood the importance of talking to their community to assess need prior to setting one up. Stories were shared openly in the group. Participants felt they were able to learn from each other about what did or didn't work. Practical tips such as the use of craft and art into a yarning circle were appreciated. Participants had confidence in other members of the group and noted it was a place where they could build and strengthen their networks, complemented by the practical knowledge of the facilitators. Several commented that they found it respectful of the facilitators to open up discussion and allow Aboriginal elders and a traditional healer to share their reflections. Self-care was discussed as an important part of running a yarning circle, with open discussion around the complexities this posed for Aboriginal women who were health workers, as their job does not finish at the end of their workday. So we really did go into this thinking that we would have significant challenges, and I have to say Kim and I were quite nervous. But we were very mindful of what might come up as a barrier. So what we expected actually didn't end up being so bad. We did wonder if we would have problem with recruitment, and that ended up not being an issue at all. We really wanted to make sure that we engaged the participants so that they were happy to attend over the 2 days, and mindful that if there was something like a death in the community, that we might lose half or maybe even all of our participants, but that didn't happen. We also became aware through our informing ourselves that we non-Indigenous people work in quite a different paradigm to Indigenous people. We work in a much more time-based paradigm, and Aboriginal people work in an event-based paradigm. Hence, if something significant does happen, that is their priority. We had to work with the different values and cultural norms of the individual country within the group. Kim and I were required to be very flexible and be very flexible about the program we delivered. And we were also mindful of the group dynamics. For instance, we had elders and aunties in the room, and we were aware that some of the younger women would be very deferential to these elders in the group, and that did end up being the case. Hence, the use of art was a really powerful medium for them. But the unexpected challenge was what threatened to derail the whole 2 days. By lunchtime on the first day, we were made aware that many of the women had experienced the presence of spirits in the accommodation. They all came in the day before and spent the night in the accommodation and in the training facility. Pretty much all of the women experienced it, but not all. About a couple didn't, but it caused a huge distress to really everyone because some of them actually refused to go back to the accommodation, which we had to then deal with very, very quickly. There were also differing views of how to manage this from the participants, because they had different experiences, and one elder thought differently from another elder. This led to a change in the afternoon program of day one and the carrying out of a sage smug smoking ceremony at the end of the day by our Aboriginal elder participant and the support of the NCIE. We needed to re-accommodate 3 of the women who would not return to the accommodation. So this is another lovely picture of Wendy with her surfboard, and this is just some feedback which I think really encapsulates the 2 days. Cancer is a story that is better shared. By connecting through a yarning circle, women bond and reach out, and in doing so they take back some control in their relationships, help strengthen their community and their family's resilience, and raise awareness. They connected with health services and overcome their personal fears, and they chose not to be defined by their cancer. Just in closing, this special picture is from one of the youngest women in the group, who we really did not hear very much from. She was very deferential and very quiet throughout the 2 days, and yet she produced this beautiful artwork over that 2-day period. And we did ask women if they were comfortable to share this, and some of them said that they were. So she wrote, "This turtle represents coming together, sharing ideas, stories and knowledge to take back to our own communities. It also represents 2 organisations, 2 worlds coming together for our Aboriginal people." So this is a picture of the group of women, and where we're moving forward to is that we have connected all of the women with their local Cancer Council regional offices. We are supporting them with support and resources to establish groups in their communities, and since the training, 2 women have started a group in the Mid-North Coast and another 2 on the Central Coast, and we're working to develop an online leader group through our cancer online community. So thank you very much, and I'd just like to acknowledge my colleagues at Cancer Council who were invaluable over these 2 days. Thank you.